Baekyo. Okay, I think Dr. Taka is here. Um, we are gonna go start right away. We need no introduction for Dr. Taka, and of course, we are seriously keto.
My
Doc-
sideways.
you are sideways, Dr. Taka.
How do I fix that? Well, that's really frustrating. Hey, what to do? What to
Hi,
do?
Andy
Oh, I have an
Whitney.
answer. I know
Yes.
what to do. Give me a moment. Just gonna, no,
Hi,
not
guys.
that.
Thank you for joining us. It's a live show with Dr. Tucker, although he's sideways.
Okay.
And we are at the Seriously Keto. We are the anti-sugar club because we serve everything sweet with no sugar.
Okay. Hold on.
Okay. Oops. Oh, okay. You're the right side up.
Voila.
Hi, Pete. Hi, Melanie. Hi, everybody. Andy Whitney is on.
Andy Whitney from
Yes.
Jakarta to
No,
Maine.
yes, he's there. Yeah.
He's in Maine.
He
Yes,
is
I don't need
there.
glasses. I can see clearly now. Thank
Hi,
you,
Dr.
Janti.
Taka.
Hi.
So, want to introduce yourself again or a little
No,
bit?
you introduce me. You do
Oh.
such a good job.
Dr. Taka needs no introduction. Well, he is my good friend. He is my advisor. He is my
I
go-to
wrote in your
person.
book. I'm
Yes,
in your
you wrote
book.
in my book.
Mhm.
So, yes, Dr. Taka is an oncologist and he specializes in breast cancer and prostate cancer. And also, he helped people reverse diabetic type 2. What else can I
Yep.
say? More
Um, um,
hormone?
oh God. No, I mean, it sounds like I do a lot of things.
You do?
I help them
You do?
help them find unicorns. I can do cooking. I'll pick you up from work, help you move a couch, whatever you need. Yeah,
See? Told you. He's the best.
full service.
Yes,
Actually, go
sorry.
ahead. No,
Someone
go
actually
ahead.
say, thanks to Dr. Tucker who prolongs my life, taking care of my diabetes.
They do it themselves. They do it themselves. I mean, yeah, no, we're a witness. Whoever that was, good job. You're doing it. Yeah. What do you
So,
want to talk
what
about tonight?
we want to talk about the anti-sugar. We like that a lot.
Anti-sugar.
Yes.
What is that, like protein? What's anti?
Uh, no, whatever that is, no sugar. So why is sugar bad?
Why is sugar bad? Let me count the ways. Sugar, I mean, it tastes good, but
Yeah.
I mean, cocaine and heroin feel good. It's addictive. That's the bottom line in terms of how it tastes and feels. But the problem with sugar and what I do is that I was trained as a cancer doctor, and cancer loves sugar. It's its favorite source of fuel. It is the energy that drives a tumor. It's not the only energy, but at the beginning, it is the key driver. And so I had this I had this epiphany, that like moment when you're struck by lightning. And about 10 years ago, that if I was going to be a good cancer doctor, I wasn't going to treat cancers, I was going to prevent it. And knowing the role of sugar, obesity, diabetes, you begin to realize there's a common thread in nutrition that leads to cancer. And a lot of people don't know, unless they've heard me speak, that obesity is about to overtake tobacco as the number one cause of preventable cancers. And that's obviously touching. I mean, everybody, the word cancer resonates. But the thing that the byproduct of trying to teach people how to reduce sugar and reduce carbohydrate is not just preventing cancer, but preventing Alzheimer's and heart attacks, and obviously diabetes and obesity and fatty liver and kidney disease and rheumatoid arthritis and, all these things. There's a million things.
Oh
So
gosh, that's a whole lot.
it's a whole lot. It's, what we like? We like to think about in the office root cause. I'm kind of that
Okay.
annoying kid who, somebody, and I say, Daddy, why is the sky blue? Well, the light refracts off the sun and it changes the rainbow. I'm like, why? 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 And so people are like, why did I
Okay.
get cancer? Why did I get this? It's all about root cause. I got a question. How'd you get into this?
Oh,
Tell your story.
I got, okay. My mother's sister has cancer. My father's sister has cancer. And three of my best friends has cancer. So I was gonna like, okay, it used to
Mm-hmm.
be cancer used to be someone's aunt, someone's dad, someone's neighbor. And I think it's come in too close to me. And that's how I look like, okay, I have to look into this. And that's how I started looking very seriously about not wanting, not wanting to be friendly with
I
cancer.
think, I I'm friendly, but I would definitely say that's a good idea. That's you're not going to tempt me, you're not going to trick me, I'm not going to be friends with you. Yeah.
No,
No, you have to be um not voracious. You have to be zealous.
yeah.
You have to be so adamant,
Mm,
100% anti-cancer. Yeah.
yes,
Yeah.
yes. It's just, I was always thinking that life and death is not in my hand, but my health is. So
Yeah.
that's how I go about it anyway in everything that I do. So yeah, and then I start reading about sugar and what's bad about sugar. The more I read, the more I'm scared. The more I want to tell people, the more I want to share the news that no, you cannot have sugar. And I look like the sugar police nowadays. Every time someone eats with me, they look at me. Every time they want to eat something sugary, they'll look at me. I say, it's okay. I don't judge.
I agree. No, I agree. And I'm an omnivore, but I limit the time I eat. But before we talk about that, you being the sugar police, it actually doesn't make you the sweet police because you figured out a way to
Yes.
provide that sweet, dessert without giving the sugar.
Yeah,
Yeah.
and I tell my friends that you can actually substitute it, you can replace it, you don't have to omit it altogether from your life, but look for substitution. That's where I come in.
What was the first low carb sweet treat that you made?
Oh, something that I can hit you with and give you a very big bump.
I don't even know what that means. Explain.
I was trying out to make like a chocolate cupcake. I thought it would be the easiest. And I used the almond flour. I used the erythritol sugar. I followed the recipe to the dot. That one, I just the regular cupcake, but I changed it. Oh my God, it turned out so hard.
Like a stone? That's what you meant.
Like
You
a
could throw it,
stone. Yes.
yeah, a baseball.
Yes.
How
That's
many
a
tries did it take before your family said, hey, that's good?
took me like about maybe 3 to 4 months before every day. Every day I'm actually pretty persistent when I'm on to something. So I keep trying.
Yeah, no, I mean, we met more than 2 years ago, I think.
Yes,
And
yes.
you have just pushed through, pandemic aside, and it's been great. Yeah.
Okay. Anyways, so I am on keto and I go to you because I heard someone told me that if you want to go to a keto doctor, go to Dr.
Mm.
Taka. So
Mm-hmm.
I came to see you. So when you're on keto, people actually worry so much about cholesterol. They
Mm.
are very scared of cholesterol.
Right. Right. Yeah. Why?
Why?
That's what I asked them. Why are you scared of cholesterol? And
Because the doctor told them not to go over 200.
they told them not to let it get red. I hate the black and red printing on the lab report. And the thing is, cholesterol is not the big, scary number molecule that everyone thinks it is. And and honestly, people have the whole story a little bit confused. Let me tell this from the perspective of the patient who comes in and has been given medicine to lower cholesterol. And as you know, those are called statins. The Lipitor, the Crestor, the Pravachol, Simvastatin, blah, blah, blah. And people take those drugs, and I ask them, why do you take it? To lower my cholesterol. And I tell them they're wrong. You don't take those drugs to lower your cholesterol. The deal is doctors, pharmaceutical companies, academics, everybody saw that there's this class of medicine that might help, wait for it, prevent heart attacks or reduce the risk of dying from heart attack. When somebody said, here's the cholesterol drug, what they really mean to say is, here's a medicine that's going to, if we're right, reduce the chance of getting a heart attack or dying from a heart attack. And that's kind of the deal. It's like, here's this thing. Here's this. If you take this every day for 5 years, you're going to reduce your risk of heart attack. And by the way, your cholesterol levels will go down at the same time. So everyone's associated this change in cholesterol with the drug, but they've missed what doctors call the outcome. And it's really outcome driven that, you take the drug to reduce your risk. Now follow me. If I can promise you, and I'll use my little AirPods here, if you eat one of these pills every day for 5 years, it's going to reduce your chance of heart attack by 50%. You'd be like, whoa, okay, that sounds like a good deal. Wrong. You have to know ahead of time, what's my actual risk of heart attack? And not to be, I'm not the math guy, but it's a form of statistics. It's a simple form. There's absolute risk and relative risk. Think of it as a coupon to go shopping. If I have a 50% off coupon, anything I want, do I want to go to Seriously Keto and buy cupcakes? Or do I want to go to Harry Winston and buy my wife a diamond? Right? And so half off is half off. So now if you think about your heart, if somebody says, well, your chance of heart attack is 25%, okay, cutting that down to 12% is a good deal. But if I can calculate that your chance of heart attack is 4%, cutting it down to 2%, it's not such a big deal. And follow the math. If your risk is 4%, that means out of 100 people we prescribed the drug for, 96 didn't need it. And since it only works half the time, 2% of people still got the heart attack. So it didn't help them. But it did help 2% of people, which means 1 in 50 benefited. And it's all about relative risk and absolute risk. So everybody comes in worried about cholesterol because they've been given the short answer without thinking about what it actually means. The doctors don't have time to explain it. The patients need 5 minutes. That's all it took, right?
Yeah.
To get that across.
We don't understand.
Yeah. And I would tell you the other part of the story, without going into great detail, there's total cholesterol, the so-called good and the bad. I don't think
Mm-hmm.
it's fair to say that it's a good and a bad. There's the HDL, which we call good, and the LDL, which we call bad. And there is no clear evidence that the total cholesterol makes any difference. I
Okay.
do think that very, very high levels of LDL cholesterol
Mm-hmm.
require consideration to that high levels of LDL may be associated with a higher risk of heart disease or heart attack. But we can assess that. Come to the office. We do calcium score. We'll
Yeah.
calculate the numbers to give you that you're a 7%, you're a 4%, you're a 22%. And the beauty is if you take the idea of taking the pill to reduce your chance of heart attack, you should ask, what else can I do to reduce my chance of heart attack? Exercise reduces your chance of heart attack. Quitting smoking reduces your chance of heart attack. And we see a lot of people who come in, and I'll, just generically say they're a mess, okay? And you should take the pills. You should get a glucose meter. You should be on low carb or keto or fasting or one meal a day. And then when you restore your health, maybe we'll cut your medicine in half. Maybe we'll stop your medicine. We're going to reevaluate where you are and say you were a 20%, now you're an 8%. And the risk benefit ratio doesn't make sense to you. Yeah.
Cool.
So long story, quick, easy question, long story.
Yes,
What else do you want
it
to know?
is. Yeah, so actually when I am on keto, so how high can my cholesterol total number be? Because what I mean, like you said, what is the total cholesterol or
So
the
let's
LDL that
skip the total and let's
mm,
talk about LDLs.
mm,
When your LDLs start to go above 200,
okay. Oh, that would be very
we
high.
we need to assess what your
Yeah.
personal risk is. And I would, to be more realistic, we help everyone at the beginning assess their risk.
Mm-hmm.
And I mean, assuming your age is at least above 40, what we do at the office is we're going to send you for this test called a calcium score. And the calcium score is this gold standard test that most people don't know about, and only in the last few years have primary care doctors gotten their head around, because they were using the numbers and the calculations to assess risk. But so, all right, so here's the story on the calcium score. Historically, we would look at people and say, oh, you're tall, skinny, jogger, educated, non-smoker, and low cholesterol numbers. We think that you're a very low risk for heart attack. And a big study out of Boston, thousands of people, they said, let's go find all of these people who are really low risk by that definition. And I like to call those people the best of the best. So they got a big group of the best of the best. I mean, these people were destined to live forever. And they said, we have a new test called the calcium score. So they sent everyone through the scanner. It's an easy test. There's little radiation, yes, but it's worth it. There's no dye, there's no needles. It takes about a minute. It's easy. So they put all these people through the test and we score it. We're looking for calcium in the lining of the arteries of the heart. And it can come back as 0, which means there's no calcium, or a number that goes up, highest I've seen is about 8,000. But zeros are different than everyone else. And what it turned out was, if you're the best of the best and your score is a 0, which is about 60% of people, the best of the best who are zeros, they have the Harvard doctors, conservative group of people, they said, oh, what are we going to say? We're going to give you a 15-year virtual warranty against heart attack. I mean, that's pretty bold for a group of doctors. But if you're not a 0, you don't get the warranty. If you're the best of the best and a non-zero, you're not as good as you thought you were. But the flip side of that study was they did an equal number of people who we're going to call the worst of the worst. Okay?
Did
These
they
were
did all
people, yeah, they got these people like, hanging out at a bar, drinking beers, smoking cigarettes, laughing about people buying treadmills. These are the worst of the worst. And they ran them through the test also. And the catch is, if you're the worst of the worst, but your calcium score is a 0, your risk of heart attack is actually lower than the best of the best who don't have a 0.
oh,
Best of
how's
the
that?
best who's a 10 or 100 or 1,000. It's the calcium score that really defines that risk. And so back to your question about LDLs, we're going to assess everyone up front based on actual data and imaging rather than on fear and sort of a historical hypothesis that LDL is the cause of heart disease. Because I would strongly argue that LDL is, it's not innocent. High LDL is a bad thing.
It's not as yet.
Yeah, it's not innocent. On the other hand, though, you see people with a cholesterol of 250 where their LDL is 150 and their HDL, the good one, is 100. And these people just make exuberant cholesterol. And you look at their coronary arteries and they're perfectly clean. So you just can't, yeah. Yeah, I wasn't going to out you, patient privacy. You know what it's like. You're so kind. You refer so many people, and they're like, Janti sent me, and I'm like, who's that? Never heard of her. It's a different era. I just can't share a name with anyone. Anyway, but that's the story. I mean, LDL is to be respected. However, there are better tests.
Okay.
Yeah.
Next question.
Right. Oh no, my turn. My turn. You hold the question. My turn. I get to ask a question. What is your favorite combination of non-caloric sweeteners for cupcakes?
We use erythritol and sometimes erythritol plus monk fruit.
What about stevia?
It has an aftertaste that I don't care for.
It
does. And and we do need it to be sweet enough for people to be able to digest. I mean, to appreciate
What do you mean?
So,
what do you mean digest?
Not digest, appreciate.
Okay.
To appreciate. So so erythritol is my go-to.
And a little bit of what? Maltitol?
No, monk fruit.
Monk
fruit,
okay.
Locanto. Yeah.
Yeah, no,
I don't do maltitol.
Which is actually the best way to think of it. Is like, how could you add a banana, a slice of banana to oatmeal as a sweetener rather than like dumping sugar on it or something? People don't realize they could use a small amount of fruit, real food, as a sweetener. That's a good idea.
But they're small. I rather tell my friends not to touch fruits because eventually I said we can, but in the beginning you don't, because it gives the craving and the wants, and they don't stop. So you can't stop at a quarter of a banana. You want to finish the whole banana.
You don't want it to go to waste, right?
Yes, no.
Yes.
So I rather not. I'd rather say, like, let's, for the first 3 months, let's just not do that.
Good idea.
And
all
after
right,
that,
your
of
turn.
course, fatty liver. Yay! People keep asking me about fatty liver.
Yeah, it's 9:20 at night. Let's talk fatty liver.
Yes.
What's the question? Or just explain.
What is a fatty liver, and how you get fatty livers, and why it's sugar contributes to a fatty liver?
It's actually incredibly important. So you've heard me speak. My favorite slide when I give a talk, and I'm going to ask everyone who's watching to visualize this. You're looking at a screen, and in the middle of the screen, I put up a little icon, stick figure of obesity. And I say in the center that, here is the pandemic. I mean, COVID is, the current pandemic, but it wasn't the first. That obesity and diabetes has been a pandemic for a decade plus. And that just sits in the center of the slide. And I ask, why is that important? Because that leads to heart attack, stroke, cancer, Alzheimer's, and all those other problems.
Obesity.
And then so that's sort of like, you see the obesity in the center, and then over on one side is like the consequence, right? And then I go through an explanation of how people get obese. Where did the fat come from? And it's a straightforward story that insulin drives new fat. Nothing makes fat other than insulin. It's the main, if not only, hormone that drives the generation of new fat cells and enlargement of existing fat cells. So you have to ask the question, if insulin is doing this, what causes these high levels of insulin in the body? And I'm going to come to the fatty liver. So, I mean, I'm not just doing a science lesson here. And the thing is, high blood glucose drives high insulin levels. So then you have to ask the question, well, what drives the high blood glucose levels? And mostly it's dietary carbohydrates. Okay? It's not good food, bad food. It's not healthy, unhealthy. It's just carbs. There's no editorial. There's no good carb, bad carb. Carb is carb. Okay? Exercise, physical stress, sleep also play a big role in changing adrenal hormones, cortisol, which also raise glucose, drive insulin. So not for tonight, but all of that is what makes insulin go up and builds fat. And then you see the consequence. Then, just before I finish the slide, I throw in a picture, an icon. So it's not, people don't freak out. It's not a big fatty liver. It's just a cute little liver. And it's in the middle between the obesity and the diseases, the consequence. Because the first thing that happens when you have excess sugar, carbohydrates, is you get fatty liver. You don't get the heart attack, stroke, cancer, Alzheimer's problem right away. You actually, the very first thing is fatty liver disease. And the reason for that is that the liver is where we normally store glucose in the form of glycogen, a long-term, medium-term storage form of sugar. And the problem is when that liver gets full, says like it's a closet, it's the trunk of your car, it's like there is no more room, then insulin converts any extra glucose into fat. And it can deposit it in the liver, deposit it in my belly and visceral fat, deposit it in my brain and my heart, everywhere. And that's what happens first. I recently saw a patient who had mild to moderate insulin resistance, little overweight, pre-diabetes, belt size went up a little bit of high blood pressure, like tipped, into the risk state for everything. And then when we looked at the liver with a special blood test or an MRI, horrible fatty liver, like very, very discordant. And this happens in about a third of people. It's like overwhelming fatty liver, and it just keeps waiting and waiting and waiting, and then it tips over to the rest of the body.
Right. You don't have to be fat to have a fatty liver.
No. You can, there is, and again, I think it's very editorial, and there's probably better terms, but I'll just say it. There's the skinny fat. And skinny fat it's not an accurate term, but it goes back to the calcium score idea. Don't judge the book by its cover. And that there are people, whatever the body shape and size is, it doesn't always predict for the objective health of the engine that's running the machine. Yeah. But if you'll give me, I'm going to give you one more piece of the fatty liver.
Yeah.
This is a question. Go ahead.
Sorry, what do you test to see a fatty liver?
There are 3 ways that we like to consider looking at it under different circumstances. First is a blood test, and it's called a liver fast. And it's a special test that gives us 3 measurements in the liver. It gives us a biochemical estimate of how much fat is actually in the liver, as sort of as a percent between 0 and 1. It also can tell us if there's inflammation in the liver, and it can tell us if there's fibrosis or scarring or cirrhosis in the liver. Some people get very, very fatty livers, but the liver is very forgiving. It regenerates. You can have fatty liver, but no inflammation and no cirrhosis. If you're a chronic drinker, you might not have a lot of fatty liver, but you might have a lot of fibrosis. Yeah. So that's one test, the liver fast. Another test we like, there's an MRI that we can order that is different than all other MRIs. Mostly MRI and CT scan look for the shape of something, like we're looking for a lump or a bump or a tumor. This one takes all of the digital ones and zeros that you get from the MRI and converts it into a number that we use to look at the amount of fat in the liver or the amount of inflammation, or very importantly, the amount of iron in the liver. If we want to talk about it after, what I want to get across, iron is a really big problem, excess iron. It's a very common problem, especially in Angmos, in Caucasians, that they don't realize that they've got multiple risks on the liver. And then the third test is either an ultrasound of the liver or a traditional MRI that just sort of says, yeah, that's fatty liver or mild, moderate, but it doesn't quantify it the way the other two tests can. All right, I want to tell you something about sugar. This is the one I want everyone to know. It's kind of a trick question. I ask patients if they've heard about blood glucose. You know, we all measure our blood glucose. And they've heard of fructose, which is the sugar in fruit. And we can name, you would know this, the 160 different names for sugar and non-sweet, all of yeah. But if you actually ask someone, what is sugar? Most people draw a blank. They're like, well, sugar is sugar. I'm like, no, I mean, there's glucose and there's fructose, and there's lactose in milk and there's, and they're like, so what is, if I said I'd like a spoonful of sugar for my tea, what are you asking for? And nobody knows. And they forget that sugar is sucrose, right? Yeah. And so glucose is this like one molecule with with 6 carbons, and fructose is a different one with 5 carbons. But sucrose is the marriage of the two. They're like, connected. And here's the problem, and this is the cause of fatty liver. It's the fructose. And this is why we tell people not to eat fruit. This is why we tell people who are trying to reverse fatty liver that they can't have fruit, they can't have juices. I don't care if you call it healthy. Fructose is something that is toxic to the liver in large quantities. And every time you get sucrose, which is sugar, as in added sugar, you get half of it as glucose, which your body knows what to do. Your body's like, hey, blood glucose, I can burn that stuff. But the fructose, I mean, again, glucose, I studied chemistry as an undergraduate. Glucose is a 6-carbon ring. Fructose is a 5-carbon ring. It's a totally different thing. It's not like diesel and gasoline. It's like, I don't know. It's steak and cucumbers. They're totally different things. And that fructose, and there's really nice studies, especially in kids, obese kids, that if you stop them from eating fructose for a week or 10 days, they will reduce their fatty liver significantly, dramatically, because fructose is a toxin on the liver. And it's so important to get rid of fructose and to understand that every time you have added sugar, it's 50% fructose. And that's why that high fructose corn syrup is so horrible, because it's actually 55% fructose and 45% glucose. Yeah. All right, I'll get off my fructose soapbox. Yeah. And if anybody wants to learn, you should listen to Robert Lustig. He's a pediatrician at UCSF. He taught me everything that I ever needed to know about fructose. I mean, he's a kid's pediatrician for obesity and diabetes. Yeah.
That's
all right.
crazy.
My turn. I talk now. Yeah. Now I get to ask you a question.
Okay.
Let's see. Do you ever have a cheat day?
Oh, okay. I plan my cheat day.
Once a month? How often?
It depends on the date.
So not a regular thing. So a special event.
A regular. It's a special event. Yes. So yes, I do have cheat days, and I do have it's planned, and I made sure whatever, bring me to a sushi place. Why not? I would definitely just eat with you, drink sake with you, as long as you make a date with me first.
I follow my cheat day with fasting.
Yes, yeah, that's what I do.
I think that fasting's a really useful tool. So
Yes,
that
that's
helps
how
a
I
lot.
do it. So I fast before the meal and I fast after the meal. But I really enjoy the meal totally with my date.
Good, good. Well, we're gonna have to go get sushi when we can travel again. We'll make a run to Tokyo. Is it breaking news? Someone what's
Oh no. Yes, let's go. Sushi. Sushi date.
All right, your turn. What's your question?
Uh, I don't know if it's a myth or it's red meat causes colon cancer.
Red meat is associated with colon cancer. Nutritional research is filled with poor quality science.
Oh,
And it doesn't mean it's wrong, it's just about the degree of evidence. And academic physicians hold the double blind randomized clinical trial placebo controlled as the gold standard. But as you move down the evidence ladder, association studies are often done. And as an example, and this can be inflammatory, others may, dispute me with this, but it makes the point. If you ask someone, there's some famous studies where the nutrition scientists call up people and they're like, tell me what you ate yesterday. Join my study and tell me what you ate yesterday. And so they say, okay, I had this, I had this, I had this, and the day before I had this and this and this. Okay. And then they're like, okay, thanks for being in the study. We're going to call you back and ask you what you ate for the last 3 days again in 1 year. And they might do this for 5 years, and it's just this nutritional recall. But it is clear from those studies there's an association that excessive red meat might be associated with the risk of developing colon cancer. And then when you start breaking it down, well, is it red meat? Is it processed red meat? Is it, and I won't use names, but like some big manufacturer of, packaged bologna or something, as opposed to what about, for better or worse, this is not true. I'm saying, imagine you grew up on a farm and you raised a calf and it turns into a cow and you know the hard facts of life. You slaughter the animal ethically, and you're going to eat the beef and use the as much of the animal with gratitude to feed yourself and your family. And it was grass fed, organic, never given anything. And so that's not necessarily the same kind of red meat. Now, when we talk about keto, a lot of people come back and they say, first thing people who are confronted with keto, who are not aware of the spectrum of keto, they say, I can't eat all that fat. And I said, well, no one told you to. I mean, that's not, or I can't eat all that steak. Like, that's not the way it's supposed to go. First, we didn't say go eat red meat. We said eat protein. A traditional keto diet is what, 20-25% of your energy from protein. You can get that from fish. You can get that from chicken. You get that from pork or beef. You're supposed to get what, 70% from, fats and 5% carbs. That's like strict keto, epilepsy kind of keto, rapid weight loss with caloric restriction keto. But people get in their head that they've got to like go eat a side of beef, and you don't. I do talk about this with my colorectal stomach cancer patients who have cancer of the entire GI system. I want to make sure that they understand I'm not advocating that they eat red meat. I'm not saying that they should avoid it either. I just think it's really important to avoid processed foods, including processed meats. That's really the key. But red meat gets a bad rap, and I say that because you know what? I love asking people to do the carnivore diet. Have you had anyone? Do you know anyone who's done it?
Yes, I did. I do. She's thinking of going off it though because
It's difficult.
it is. She
It
says
is
it's
difficult.
very expensive though at the end of the day.
It can be expensive. Well, I mean, it depends what cuts you're getting, but it can definitely be expensive, and it's just boring for some people. I think
It
it's a
is.
perfect
It
fit
is.
for others. I've seen a few people who pursued it, and mostly they completely reversed autoimmune disease.
Yeah.
That's really where it comes up for me, is anything from severe skin disease, autoimmune disease, not so much about a diabetic reversal, but
No,
really it does a good job for lupus and rheumatoid arthritis and all the subtypes of those illnesses.
she's doing it, I think, because her son is mild autism, and
Hmm.
she's doing keto, and then she just 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 venturing out to carnivorism.
Good for her.
Eh,
Good for her.
Yeah. So, but yeah, yesterday when I met her again, like 2 3 days ago when I met her, she's like, "Oh, I think I'm going back to being a keto carnivore." So she's still allowing herself like avocados and
Yeah.
all that, not purely carnivore.
It's an
Yeah.
elimination diet. I mean, I think a slightly more gentle way to approach it is to tell patients, whether they have irritable bowel or autoimmune, or just eat clean animals.
Clean. Yes.
It doesn't, grass fed ideally, but some chicken, some fish, and vegetables that grow above ground, and
Yeah.
olive oil. You'll be fine. I mean, that's
Yes.
really, I mean, if you want to be slow in your success, which is like more comfortable, then, don't worry about your calories. If you're looking for like to get into your wedding dress in 8 weeks, control your calories.
Yep. Calorie
Yeah,
counts still.
that's an important thing. Most people forget when they get into keto in the early days. Calories, calories
Still
still
count.
matter. They still
Yeah.
matter. Like calories are not everything, but if you don't respect calories, you'll never get your success.
Yeah, and they're afraid of the fat though. They're like fat is bad. So
Fat phobia. Oh, I mean, but that's why you're here. That's why we talk about these things. Don't be
yep.
afraid. Yeah.
Um, so
Yeah.
fat is not bad, huh?
Fat is not, but I'll tell you what is bad. Processed oils,
Yes.
seed oils. People don't think about this, but they're called seed oils. And they're not natural in any way. That soy oil, corn oil, safflower oil. I'm no expert in the oils. I try to restrict myself to telling people just stick to these things and you'll be okay. Olive oil, avocado oil, and coconut oil. I try
So
to live in olive oil, and that just makes me, it just, I don't have to deal with everything else because the seed oils are highly processed, highly manufactured, and they may independently contribute to the development of chronic disease and excess
yeah,
insulin, along with
yeah,
carbs.
yep.
Yeah.
And these fat doesn't I mean these oils considered as fat, it's not bad for your cholesterol.
So that's a trick
Yeah.
statement or question
I got asked
because
that so many times.
because that's sort of, I mean, you're like, well, is giving charity bad for my cholesterol? Is running a red light bad for my cholesterol? Well, here's the thing. Why are you worried about your cholesterol? It goes back to our first question. The whole thing is a fake argument that you're like, don't ask that question. Let's talk about, is cholesterol important? So it's a trap. You don't answer the question as presented. Say, let's talk about cholesterol first and whether it's a good or a bad. Is there a problem? Because cholesterol doesn't matter. What matters is heart attack.
Mm-hmm.
And so the question shouldn't be, is this diet bad for my cholesterol? Is this diet bad for my chance of heart attack or death from heart attack? Skip
Okay.
the middleman. You're like, oh, I know where you're coming from, but let's think bigger.
Okay.
You're not worried about cholesterol Because if you raise the word cholesterol, you're actually worried about heart attack or stroke. You're
Mm-hmm.
worried about getting a problem. Don't worry about this number. Worry about the disease. That's the key. So it's a trick question. I'm not going there.
Okay, your turn.
Okay, my turn. What? So one of the things I love about the shop is, aside from all the yummy baked goods and savory treats, you are what I call a stockist. Okay, that's like this
Stockist.
old English term. You have everything. Like you're like, oh, who's got, ketones, exogenous ketones? Who's got a ketone meter? And who would, you read about, I don't know, bulletproof coffee and like the little measured packets and things. You have everything. What is what can't you keep on the shelf? What do people buy and you just need to order more and more and more?
Oh, those sweeteners, the hazelnut
Uh,
sweeteners. Yeah, for their coffee. They love that. So they're sugar free,
uh-huh.
and that's one. And the other one is pork rinds.
Yes, chicharrones. Yeah.
Yes, yes,
Oh
yes.
my God. So here's my
That
favorite
flies
recipe.
that
I haven't
flies
made
off
this in a
as
long
well.
time. Baked zucchini sticks. I love that. So you slice the zucchini, you salt it, you drain it, water it, and all of that, and then you make this coating that is the pork rinds and Parmesan and almonds, and you take the zucchini strips and you dip them in an egg wash, and then you coat it with that stuff and bake them until they're crispy the way you like, and you eat it with what is it, the spicy, the crystal sauce, which is low carb. I
Yep.
love that. Those are my favorite. But you need the pork
Oh,
rinds. You need the pork
yes.
rinds to make them.
The pork rinds goes off the shelf.
Yeah. Oh, so I think you and I should make a cookbook. All of our, yeah,
Yes, we should.
yeah. Well,
Yeah.
yeah. The first one will be my Dr. Tucker's zucchini sticks.
Okay. Okay. We have a few questions from the audience, from your friend and my friend. So there's one here. She's asking about, Allison asks, would you recommend a keto if you have sticky, thick blood after COVID?
Hi, Allison. Nice to hear from you. Would I recommend keto if you after COVID illness?
Yes, she
Was
had
that?
COVID, bad one.
I wasn't gonna out her. You did it, not me. But I'm glad that Allison is up
Well,
and
she
about and
asked.
happy. Yeah, COVID's real, people. It's um so yeah, I think keto is fine. Um I it's really important to maintain, achieve good metabolic health in the setting of prevention of COVID and recovery from COVID. How you achieve it. Keto is fine, low carb is fine, fasting is fine. The the it's very, very clear that obesity, hypertension, diabetes, and asthma, and combinations of those conditions, also chronic kidney disease, all are independent risk factors for death from COVID, going on ventilator with COVID, even getting COVID. And when you start adding them together, it becomes even higher risk. Like, it's one thing to have diabetes and the risk is like 5 times of mortality from COVID. But if you're diabetes and obese, it's like 10 times. And the big driver, everyone, the thing to remember about COVID related illness is that it can happen to anyone, and B, the chance of it happening increases with age. So my 90-year-old father is way more at risk than my 60-year-old brother. That's for sure.
Okay.
But that's,
Yeah.
yeah. But you can do that, Allison. Yeah, absolutely. I would just focus on low carb. I don't think keto is an absolute requirement, but it's not
Yeah.
something you don't need to avoid it either. That's for sure.
Yes.
Next question.
Uh, Next question is from Millie. She's in Jakarta. Is it true that high triglycerides is the pathway to diabetes?
High triglycerides are a hallmark of metabolic disease. So the way the pathway works is, as we were saying, so I always make this story about when I'm teaching people about metabolic disease that the hormone, first of all, the hormone insulin is the villain in the story. Insulin for 80% of people is the driver of disease. All right. There's always an exception. So I sort of make it an 80-20 kind of story. But insulin is the driver of disease. Now, let's say I was going to post a job description for insulin. Like, I'm looking for a molecule who can do the following. Number one, move glucose from the blood to somewhere where I can use it. Because think about it, glucose in your blood is worthless. You don't,
Mm-hmm.
it's like gasoline flowing in the river. You have to put it in your car to make something work. So insulin's job number one, is to move glucose from the blood into the liver, the muscle, the brain, somewhere where we can burn it. That's great. Job number two, when you have excessive glucose or glycogen, insulin's job is to convert it into long-term storage. And it does so by converting glucose into triglycerides. That's what it does. So anyone who's got excessive triglycerides on a fasting blood test is definitely showing excess glucose, insulin, glucose storage, and insulin resistance. It's part of the definition of the metabolic syndrome, which is, obesity, insulin resistance, high blood pressure, plus high triglycerides and low HDL or good cholesterol. So it's not that triglycerides are the problem, it's that triglycerides identify there is a problem. That's the way to think about it. We normally, on the labs in Singapore, it'll say that triglycerides should be less than 150. They're wrong. It should be less than 100. The lower, the better. That's for sure. Yeah. So, next question.
It's from May Scenario. She's asking, would you recommend keto for an 11 years old?
I think I would need more information to sort of talk about that. I have concerns about any kind of restrictive food approach to food in kids because of the risk of disordered eating. I think that you need to limit processed food and processed carbs, but I don't think that keto at that age, and I don't know, is this kid have fatty liver? Is this kid got ADHD? Do they have, or are they, on the gymnastics squad? I don't know. So without a specific background, I wouldn't recommend any specific diet for children. I would make sure that they limit their screen time, get lots of activity, eat what they want as long as you keep them away from processed food. If your
And
kid,
sugar.
yeah,
And sugar.
exactly, and excess sugar, yeah, of course. I will tell you that there have been times I've given talks to some of the international schools over the years at the high school level, and there, when you get into ketosis, you get that energy after
What is what is the second video, Ariel?
keto flu.
Sorry.
Once you're in ketosis, it's not a high, but it's a focus. And I've actually spoken, I mean, we tell high school kids to do impossible things. They're supposed to get good grades, do extracurriculars, take their standardized tests, get 8 hours of sleep, right? There's a million things that they want to do, and that's not including play video games, get a boyfriend, girlfriend, have a social life. And one of the things that I have recommended to, kids who are more 16, 17, 18, and I understand about the disordered eating. If you can alter your diet to get rid of the processed food and eat a clean, sort of low carb diet, not only will it give them focus and give them more time, Carbs drive acne. Carbs drive impulsive behavior. You're just a better version of yourself on a low carb diet. But 11 years old is very different without that background. Once they're more mature to make reasonable choices, you can talk about when is the appropriate use of dietary change to achieve a specific goal. That's really what it's about. We
Okay,
have time for
Dr.
more?
Saka. In 5 minutes or less, it's gonna go off. So if you are willing, we can always restart this and continue. Because are you willing?
I'm in your hands. We can keep going. You have a lot of questions?
We have three more questions probably.
Okay, we can keep going.
Okay. All
I'm gonna
right.
give you till
So
10:15. How's that?
okay, that's good. That's good. Yes.
Okay.
Anyway, Pram, soy oil is really bad.
Yes.
Okay, so we're gonna end this and then we're just gonna restart on a new
Okay.
video.
Let's make
All
sure
right.
I can do the tech.
See
See you in a bit.
see you in a
Bye.
bit.